All right, so I want to lead with two things. One is that I'm dealing with hives right now. So if you see red, itchy spots, that's what it is. 5-year survival rates for typical cancer, breast cancer, is 80 to 90% survival. Inflammatory breast cancer is half of that. This really is the context for the roller coaster that was my cancer diagnosis. Keep that in mind as I share the story with you. So journey back to the year of 2022. It was February and I had just found out that I was pregnant. We were so excited. We immediately started planning for a home birth because we are crunchy. We're like natural living kind of people. We eat mostly whole food and organic, and we were raising our own meat and eggs, and we use natural products. I had never been on any medications. I didn't even take hormonal birth control. We didn't even have a microwave for like the 10 years of our marriage. We didn't own a microwave because we had read a study that it was maybe harmful. So that's the context of the world I was living in, you know? I was planning a home birth, going on hikes, taking care of my chickens. So guess what was not on my radar? Cancer. So a few days before I found out that I was pregnant, we noticed a little tiny nodule on my left breast. And my husband even said, if you weren't pregnant, this would be concerning, which that's some intense foreshadowing. I always get on his case about ruining movies for me because he can tell what's going to happen at the end. And this was no different. But guess what? We were pregnant. So the typical breast changes that come with pregnancy, I was experiencing all of those. I had increased tenderness. I had swelling of the breast. I had my milk ducts going crazy, except by April, I noticed that it really was different between the left and the right side. I was having more of edema kind of swelling where there's like the fluid buildup, and my bra was leaving indentation marks on my left breast. And so I noticed there was something different happening, and I was kind of thinking, I'll wait and see what happens with the right side. This was the end of April. Well, the month of May, those 3 to 4 weeks, I rapidly developed redness of my breast that it was so painful, and that cyst was little, and then it just exploded. It was like this big. I had an appointment scheduled with my midwives for my 20-week appointment. So I brought it up then because you know what this looked like to me? It looked like mastitis. A couple of years before, with the breastfeeding of one of my sons, I developed mastitis. So I'm thinking this looks a lot like mastitis. And when you have mastitis once, it's way more likely to recur, especially in the same area. And that little like cyst thing was in the exact area that I had the clogged duct with mastitis. So I go and I ask, is it possible to have mastitis during pregnancy? And they said, yes, it is possible. And they started telling me the different treatments, and then they did a breast exam. Now, they are very educated in breastfeeding, breast health, breast infections, all of that. And they were also educated on inflammatory breast cancer. So there's this like unicorn thing that happens very, very rarely, but apparently I had all the symptoms and they were concerned. So that was 11 a.m. I had an appointment with them. They sent me immediately to the doctor that they work closely with, and that was at 1 p.m. My husband leaves work to meet me there so he can watch our kids. And we're thinking they're kind of overreacting a little bit, you know, like probably just a cyst. What are the chances that it's breast cancer? I hadn't even heard of inflammatory breast cancer, so I had no background knowledge of what that was. And I had never heard of breast cancer appearing so quickly. So I had this weird reassurance that like this came on so fast that it's definitely not breast cancer. So I go to the doctor, and that doctor is equally concerned. She said that there's a couple of different things it could be, but this is why it's not this is why it's not that. And I was like, well, then what do you think it is? And she said, well, I hate to say it, but inflammatory breast cancer. She said it's a rare cancer. I've only seen it once before in my career. I was just kind of like in disbelief because you're telling me it's rare, so why would I have it if it's rare? It's rare that I would even have cancer in general because I'm so young. I was 29, so like why would I have this rare kind of cancer? So the next day after seeing her, I go and get a mammogram and an ultrasound, and I told my husband, if the radiologist is worried, then I'll be worried. Well, I got there and the radiologist was very worried. They found 3 tumors in the ultrasound, and they also found a swollen lymph node that was suspicious for malignancy. So I got 4 biopsies done that day, and they left me with a score of 5 on their BI-RADS scale. So 6 is that you have a confirmed biopsy of cancer, and 5 is 95% chance we just don't have the biopsy confirmation. And so I left there with the 5. And so I knew that I had cancer at that point, and I didn't know what kind. I didn't know if it was inflammatory breast cancer or if it was a regular kind of breast cancer. I had briefly Googled inflammatory breast cancer when the doctor had told me about it the day before, but it was so rare, and I kind of just didn't even give it much thought. I did know that it was aggressive, like very aggressive, deadly, all that. So then they call me the next day with the biopsy results. Guess what the biopsy results were? They were positive, but it said invasive ductal carcinoma. I'm thinking these are different words. Invasive ductal carcinoma are not the same words as inflammatory breast cancer. So I'm breathing a sigh of relief at this point. Yes, I was just diagnosed with cancer, but at least it's not that rare aggressive cancer. And so then they sent me to the oncologist the next day. The oncologist was working off of the pathology of the biopsy, and he's leading with optimism. He's like, we can treat this. This is curable. You have these treatment options. You know, what choices do you want to make? Like all kinds of beautiful words to my ears. And then he did an exam, and his face fell, and he said, oh, this is inflammatory. And my words were like, wait, isn't that rare? Like, what are you talking about? What are you talking about? So I left there and I Googled and actually read the words this time. And it was no bueno, you know, it was not good. At this point, I didn't know if I was stage 4 or if I was stage 3. But what I was reading was that a lot of people with inflammatory breast cancer find out when they're stage 4 because it's so fast and aggressive. And I didn't have any body images at that point, so I didn't know. Stage 3 is 50%. And the stage 4 statistic is 19%. So you have a 19% chance of making it 5 years. You know, making it 10 years, 15, like those numbers just keep going down, you know? So I was pretty rocked. Like I was like in shock. And I actually never ended up finding out if I was stage 3 or stage 4. So that's a story for another day. Beyond that, it gets into treatment and all that stuff. But yeah, I was 20 weeks pregnant, and everything changed. Everything just changed. So maybe I'll detail some of the other stuff later, but I did want to encourage you. If you feel like there's something going on in your body that's not quite right, go get it checked out. Because best case scenario is that it's nothing. You just go home, and worst case scenario is you get a life-changing diagnosis. I will talk to you guys later. I hope you're having a good day, and I'm gonna go take care of her. Bye.